be widening it and darkening it.
I'm not uncomfortable at all. I feel
Good.
very relaxed.
Good. Tell them about your eyebrows, how you felt when we did your brows last year.
My eyebrows, I don't even remember there being any pain to it. I mean, there was that little prickly, but the aftercare, I mean, we put on the salve that you directed, and I don't even remember having any swelling. There was no flaking or anything. It was great.
Good.
I'd recommend it to everybody.
And she had her brows done about 10 years ago somewhere else, and so there was a little bit of color that was left. It was kind of a grayish blue color. So what was nice is I was able to make it a more complementary color and to where she wasn't having to put makeup on.
Now, if you don't have any brows at all, you do this
Hair
the
stroke?
shapes.
It's going now. It should be streaming.
Yes, I
It's streaming.
usually will tell patients to do what they're
Refresh it,
used to
anything.
as far as shape. We don't want to change it unless it's not, like I had a patient yesterday that came in, and the way she was putting them on, it made her look surprised. They were way too high and straight across, like too horizontal. So I kind of put a new shape on and showed her. And of course, usually people don't like that at first because they don't like the change. Because it's like if you went to the makeup counter and they said, oh, let's do this, and it's nothing you're used to. You're going to kind of not like it. So I tell patients, give it a chance to get acclimated to that for brows if we do change the shape. But if a patient's shape looks good, then we leave it. We go with it. Yeah. Okay, so now I'm coming back to the right. So I had done the one pass. I don't know if you can all see just that first pass. Are you guys able to see that at all? Not really. Sorry. Now I'm just going to be coming back and adding more color. Turn just a bit. Good. Has anyone in the room had makeup before? Yep. Okay. How was your experience before? When you've had it done, did you do well, or was it
I had done it 2 different places, and the first place was not a good experience. So then Stephanie, I came over here last April and had it done. It was a night and day experience. So it took me a long time to realize that I was able to want to do it again. So.
And you're glad you did, right?
Absolutely, yeah.
Good.
Watching you live here, or
Does it come off? If it comes off somebody very easily, was the process wrong, or was it their skin?
It's not usually ever the skin. What it is if it flakes and exfoliates and it's only there a short time, it's usually that the technician is not getting it in the dermis. Usually with those patients that I hear that from is they'll say, yeah, it was there, but it flaked off really quick. It didn't seem to stay, and they told me it's my skin. That's not a true statement. And a lot of times what happens is, like I said, they're kind of tentative because they're scared and maybe they're not experienced, and they're not wanting to, do something that they're not sure about. A lot of times people like that too will say it didn't hurt at all. They'll say it wasn't painful at all. And not that it's painful, but you're gonna feel something if it's being done right. So I have patients that come in and they'll say, well, I had it done a couple years ago at this place and it didn't hurt at all, but it didn't stay. And I'm like, well, that's because they were probably too superficial in the skin and it just flaked right off. So that's why, sometimes you'll see these deals, oh, it's $100, have it done, and you're gonna get what you pay for most times. Because they don't regulate this in Arizona, so anyone can tattoo and not have any experience, any credentialing at all. So you have to be careful because it is your face, and there's blood involved, so you want to know where you're going is sanitary and has, the person's trained in bloodborne pathogens, because you don't want to be getting HIV or hepatitis or something. That would not be good. And they're skimping on something. If they're that cheap, There's a reason.
Excuse me.
You doing okay?
I'm doing great.
Good.
Do you numb it first a little or something?
Yes, so prior to starting, we did a numbing cream for about 15 minutes. And then as I work, I reapply.
Oh, you do. Okay.
That way you stay comfortable. So I don't know if you guys can see that a little bit.
And I really am very comfortable. I'm feeling no pain.
Oh,
Now-
you don't feel anything, really?
You know, I just feel like the little motion,
Oh,
but I honestly feel no pain, and I mean, I'm very comfortable here.
What is the aftercare like for this?
So for 2 days, I have you put ointment on twice a day for 2 days. It's Aquaphor ointment that I supply to you. And then with the liner, they will feel a little beat up for a couple of days. So you're gonna wanna use some cold compresses for the first few days if you need it. Some people say, oh, I never used them. And then no swimming for 5 days, no makeup for 5 days. And that's pretty much it. And then you'll come back 8 weeks later and we touch it up. That's included. And at the touch up is when you're gonna want to go darker, thicker. If you have the brows done, we're usually adding color at that time to darken
And
them.
that's 6 weeks. Or 8 weeks.
Between 6 to 8 weeks.
Okay, 16.
Now what I'm gonna have you do, Joanne, is I want you to open your right eye.
Okay.
Good. So I'm gonna just sit her up just a smidge for you guys to see. Just the lower, we have to work more on the upper, but I know everyone's wanting to see. Can you guys see that?
I can see that.
Turn
Oh,
up.
yeah.
Yay.
So you start
Yeah,
out
you
with
can
the
see
thinner
good.
line, and then after 8 weeks, then you make the thicker line.
Correct.
Okay.
Yeah. But as I was saying earlier, when you do the lower, you don't want a real thick black
Yeah, do
line
not.
because it just makes your eye look closed in and small. So on the lower, I recommend go thinner. You know, go with just like a lash enhance. Put your chin down a little bit, Joanne. Thank you, honey. And you want
Kind
to
of a smudge look instead of a straight line?
not
No?
smudgy, no. Just a little wider and then tapered skinnier. But the bottom, you want it just in the lash line and not too thick because it just makes your eye look like a little pea hole. Now on the top, I've just done that one pass. You can see there's just a little bit of color there. Now what I'm doing is I'm gonna go back and thicken and darken the top, and then we'll be done for today. Then when you come in for that second session, we're gonna darken and thicken again. But the eyelid skin is very thin skin, so you can't work, because you're not gonna get color to stay. It's just gonna flake off because you're gonna get so beat up. So you wanna do it in steps, okay? I'm gonna lay you back, honey.
Okay.
Too bad you can't sleep during this, huh?
The second
I almost
session,
should.
is the second session, is there an additional charge or is that
It's
all?
included.
It's included.
Yeah, the touch-up's included. And I do see you for consultation first, and that's complimentary, but that's required because I want to
It's
know.
not complimentary?
It is.
It is.
Yeah. Because I want to be able to, we have to talk about any medications you're on, if you have any history of having this done, or any eye problems, or skin disorders, or health issues. All of that affects your skin. So for instance, I'll have patients come in and they'll say, well, I'm on a blood thinner for my heart, or I'm on, you know, whatever. And that might be something that we need to wait and stop or change before you tattoo, because the tattoo is a medical procedure, okay?
And which color you decide on, right?
Right, and
Choose
we
your
talk
color.
about color and shape and all of that. So the consultation is critical, and a lot of patients say, well, I don't understand, you know, why do I have to come in before I know what I want? But it's more about us having a conversation.
Okay, and on color, you have a choice. I see that you're mixing. So is the most popular black or kind of a black?
I would say, yeah, between black and a dark brown. I
Yeah,
don't do
okay.
a light brown.
No.
And the reason I don't do a light brown is because what happens with a light brown is over time, it's going to fade and it looks red. And what happens is when it looks red, it makes you look like you've been up all night long and you're just tired and you just have a red kind of a ring. So you really don't want to do a light brown. You either want to do a really dark brown, black, or blue or green. Those are really the options.
Is this the same procedure as you showing out the
Yes.
other screen? Okay.
So now I'm going to go back to the upper here.
Cameraman's enjoying himself too, isn't he?
He loves his job. This is Dustin. He's our medical student. He's our yes.
Yes.
So now I'm coming back to the upper. And I've had that additional numbing on there while I was working on the left. So again, she should be very comfortable. You feel vibration.
That's it.
It's kind of an annoying vibration that you feel. And I'm going right in that lash line. Again, you don't want it too high above the lashes, otherwise it'll look like you have a big space.
Okay. So do we have to sign up today for the bargain?
Yes, you have to pay today if you want the discount. It's 20% off today.
Good deal.
Yeah.
How soon do you have to use it?
I think it's good a year, I think. Because a lot of people are snowbirds and they might not be able to get in, you know, so they just come in when they get back in the fall. And I irrigate the eye because that keeps the pigment that's splashing kind of out of the eye, off the skin, and it cuts down on the wiping because the wiping is very aggravating to the skin. So you don't want to be rubbing the eyelid with that gauze constantly or it's really irritating. Did everyone put their ticket in for the raffle? Perfect.
And honestly, the vibration isn't even annoying to me.
Good.
It's just fine.
Now, I think I mentioned earlier that with the liner, we do offer for you to take an oral sedative if you choose. The only thing about taking the sedative is you do have to have someone drive you. We can't give that to you and let you drive a car. So, but that helps to calm people down if they're a little bit anxious, which, you know, it's your eyelids, I understand. So, but I need the patient to be able to cooperate. If I have a patient, you know, squinching their eyes and moving their head and all of that, you know, you're gonna not have a good look. So
Do you numb the area first?
yes, so I did apply a topical numbing medication for 15 minutes before we start, and then I reapply the numbing. It's a different type, but you reapply as I'm tattooing, and that way the patient stays really comfortable. You know, like I was mentioning, it's one of those things where it's gonna feel like a vibration, like an irritation, but it's usually not pain. So I don't know if you guys can see how it's starting to layer in the color there. Looking good. Now, when you heal, it's gonna fade about 20 to 30% initially. So that's why you come back and we do that touch-up, and that's included.
Is there any way to repair a botched type?
There can be ways, it just depends on what's going on. Is it liner or brows, or I'm not sure who asked? Under liner?
How are ya?
What are you feeling like?
Well, it's real thick. Plus, I'm gonna have doctor remove this little
Tag.
thing. But it's thicker. I had it done a few years ago.
Yeah, with a thicker one, there's really not,
Not anything to do.
yeah. If it was, you know, too thin or positioned incorrectly, sometimes we can do some little tricks to try to make it less noticeable, but you can't remove it, unfortunately. But that's kind of why I was saying, you know, sometimes it's better to go a little bit conservatively and then add. Turn a little bit, honey. Thank you. So the needle is implanting the pigment into the dermal layer. You hanging in there, Joanne?
I am. I'm just fine. So
Good.
thank you.
So we did Joanne's eyebrows last year. Just open the right eye for me.
Okay.
Good. Can you guys see that? See how pretty that is? We're gonna do just a touch more here. Are you hanging in there?
I'm fine.
This is just an eye wash that I use to irrigate the eye. Oops, almost dropped it. And keep that skin, you know, kind of clean without rubbing and wiping too much. And I usually go slightly wider in the outer corners and then taper it skinny in towards the nose. That gives the eye an open look.
Just a needle in that thing, right?
Yep, this is a needle. And depending what I'm doing, I use a different needle. So for instance, for the eyebrows, I do a really pretty hair stroke technique, which you saw out on the wall there. And so for that, it's a very fine needle to simulate the little hair strokes. For the liner, it's a wider needle, which is 8 needles in a round configuration. That way you get that wider line. Now open the right eye.
Okay.
Look up. Good. Close. I'm going to put some more numbing there and go
Okay.
back to the left.
All right. These pillows are great.
Good. Is it working out there, Dustin?
Yeah, it's been working perfectly fine. I don't know why it disconnected last time, but this time now it's working great.
Good. So I'm going to put some more numbing here.
Okay.
And also, if you look around the room, a lot of people have gone outside to watch it instead.
Yeah, it's
Yeah,
probably...
we do eyeliner and brows at the same sitting.
Mhm.
About how long?
I tell people plan a couple of hours. Back over that way. I'm going to turn just a bit.
Okay.
So now I'm coming back to the left eye. I've had that numbing cream sitting there again. So now we're going to go back and add color.
Yeah, look on your thing, you'll have a little tiny red ticket.
So am I gonna be in your way?
Chin up just a tiny bit, Joanne. Thank you. And then I'm going to turn you just a smidge. Good. So again, your eye will feel a little bit open as I'm coming back to this lower lid here. And on the lowers, I always recommend not going too thick initially. You can always go thicker, but you can't take it off. And thick liner on the bottom will make your eye look small. But a pretty liner right in the lash line will actually accentuate the eye and make your lashes look more plentiful. You tolerating that okay?
I am.
Good.
I was just thinking of what you said about the lashes. I thought that's encouraging.
Yeah. Now open the left eye. Good. You can see how that color is coming in there. And you're tolerating it okay?
I am. I honestly really don't even feel anything.
Good.
Now, am I supposed to have my eyes shut and you just...
Yes.
Okay.
Yep.
Well, I guess it is shut and you're just doing it.
Yeah. Okay. You're doing perfect. Bless you. And the irrigation just keeps down the wiping to a minimum so that your eyelid doesn't get irritated. Open the left eye again. Good. Look up at me. Good. Close.
When you're done, are they doing the drawing out here?
Yes.
Thank you.
Uh-huh.
Are you gonna be on her left side anymore, or right side anymore?
Yes.
Okay. I think I can get a better view if I walk around.
Okay.
See Daisy.
She's stepped out. She might be watching it on the screen too. There's nobody in here right now.
Okay.
Now open the left eye. Okay. Good. Close.
I'm very comfortable.
Good. I'm so glad.
Very comfortable.
Yay. I'm going to go back to the upper lid here.
Okay.
Hello.
Hello, it looks really good on the big screen.
Good. Is everyone
for me.
watching it out there?
That's good for me.
Yeah. You'll get an A today, Dustin.
Thanks, Dustin.
Are people watching it out there? Okay, good. I'm going to go back to the upper lid here.
Okay. It's very comfortable, Joyce.
Well, good. Just remember you're going to be getting out in a bit.
Getting out?
The chair so I can get in.
Oh. Oh, don't get too comfortable. That's what you're saying. Okay.
Chin down just a bit
Okay.
now. Thank you. And I'm going to turn you a little bit. Now I'm coming back to the upper lid here.
Okay.
You're tolerating that
I
okay?
am. There's no pain at all.
So I'm right in the lash line. So you can see the color is
Now, when do you
getting,
do the drawing for yours?
when this is done.
About when?
Probably I would say maybe 15 minutes.
Oh, okay, very soon.
Yes.
It's like perfect.
What's that?
It's like perfect. I set the timer 40 minutes ago and it's 15
Good.
minutes now. Yeah, the only problem with this application I'm using is it doesn't let me zoom or
Oh,
change the white balance. So there's kind of a glare, but with the right angling, you can get it to look good.
good.
Problem is, I'm not gonna do this with the bleph.
Oh,
This
you
is
won't.
kind of
Yeah.
in the patient space.
Yeah.
So
I'm sure you have me looking marvelous.
You look marvelous.
Welcome to come in if you want to watch.
I had a phase where from being on the go and using those and
So you can see we're just doing a little thicker in that outer corner and tapering it skinnier. And then we will be seeing her back in about 8 weeks to touch it up. And at that touch up, if the patient comes in and says, I love it, but I want it thicker. I love it, but I want it darker. Or I love it and I want it thicker and darker, that's what that touch up's for, okay? But it's better to start conservative always because you can't remove it. I had a lady ask me a few minutes ago if I could help her because she had had hers done somewhere else and her lower liner was too thick and she doesn't like it. There's nothing you can do when it's too thick. And as we get older, it's not a good look to have, you know, thick liner. It really actually can age you. So you want something that's going to be complementary forever.
timeless.
Timeless look, exactly.
Eyebrows last year, and then she did eyeliner. Yep, she did mine too.
I liked it.
I do too.
I like it soft, not
Yes, yeah.
So now I'm going to have you open your left eye.
Okay.
Good.
How long does that last?
So you can see how pretty
Die.
it's looking.
I know, I think they say maybe like.
Good. Close.
I don't know, long enough.
Just a touch more here. I'm going to just irrigate both eyes now.
Okay.
Hello there.
Sorry.
If I move the light, is it better for a minute? Okay, just for a minute to take a look. I'm going to see if I need to add anywhere. So now I'm going to have you open both eyes.
Okay.
Good. Look right at me. Good. So I'm just taking a look here to see where we might need to add, if anything. And look right here. Good. Look down. So you can see on the upper, slightly heavier, tapered and skinnier. I'm going to do a little more on this right upper. Look at me. Good. The lowers we did a little bit thinner because you don't want to make your eye look smaller. Look at me again. Okay, close. So touch more on this right one.
And she puts I had mine done last March. Thank you. So nice not to have them. Get the right shape on both of them.
So now I'm coming back to the right upper to add a little more color. We're on the home stretch, okay? Tolerating that okay?
I am, but no pain, no irritation, no. I'm
Good.
looking forward to the results.
So pretty. Hello there.
Nothing about this ever hurt at all.
Good. I don't know if you heard that lady ask that she had liner and she doesn't like how thick it is on the bottom.
I did hear that, yeah.
That's why.
Yeah. You do what you do.
Yeah, it's just one of those things where you feel terrible, but there's nothing that can be done, you know?
And will it just take time for hers to fade? I mean...
Yeah, it was pretty dark. It's not going to go
okay.
anywhere really very fast.
Does it hurt?
I don't feel a thing. I've been telling her the whole time. I said I'm completely comfortable.
So I put a numbing cream on before we start for about 15 minutes. And then as I'm working, I reapply it.
Okay.
So you stay pretty comfortable. What most people comment is that it feels like an irritation, like the will make it feel kind of irritated.
And I've told Stephanie on me, it's not irritating at all. I feel the little vibration, but it's not annoying or it doesn't hurt.
How long should that last?
It is permanent, but it does fade over the years, so you do have to touch it up. Yeah, we do this twice, so you'll do 2 sessions about 8 weeks apart. That way you can get enough color in the skin and thicken it in the 2 sessions. And then at that point, usually I tell patients liner you're touching up maybe between 3 to 5 years.
Oh, okay.
Yeah, and then you just pay the touch-up price. You don't pay the full price to come in.
Now, does that hurt the eyelashes at all?
No, does nothing to the lashes. Hi, are you watching it out there?
I was. and
Good.
Let's see how she's doing.
I feel
She's
fine.
still happy.
I am
Plugging
happy.
along. We're on the home stretch here. So now I'm going to have you open the right eye
Okay.
and look up at me. Good. Beautiful. Close. Just a touch more there. Turn just a bit this way. Good. So as I was mentioning earlier too, it's critical that you place this where it needs to be. So you want it right in that lash line. You don't want it too high above the lashes, otherwise it looks like you have a big space. So it's a true eyeliner. It's not a shadow. So patients will say, oh, but I wear, you know, real thick when I put mine on. That's more shadow. We're not doing shadow. We're doing a true eye line. You'll still, you know, want to do mascara and eyeshadow as you need to. Now open the right eye again. Good. So do you see that?
Mm-hmm.
See how pretty that is? Can you see that? Mm-hmm.
Beautiful.
Good. So now I'm going to put a cold compress here, and I'm going to go back to the left just for a touch, and we'll be done.
Now, is that the black or the dark brown?
It's a combination of both.
Oh, okay.
Open both eyes for me. Good. Close. I'm going to put just a touch of numbing. I'm going to do a tiny bit on this inner lower corner and then just go over the upper just a smidge and we'll be done. So now I'm just going to put a cold compress here because the eyelids do start to feel a little beat up. That's why we split it up into 2 sessions. And the cold will feel good. And that feeling of kind of a tenderness, stinging feeling, it lasts just about an hour. And then it's pretty much resolved. Okay, I'm going to go over there.
Go around you.
Okay.
That's so much easier.
Good. Now I'm going to irrigate again here. We're on the home stretch here. Open both eyes one more time. Close.
It's been a great day so far.
Good. You're doing awesome. I'm glad you're tolerating it well. So I'm going to do a tiny bit in this inner lower corner. Now open both eyes again.
Oh, I like it. I can see it in your camera.
Mm-hmm.
I'm very happy.
Okay, close. Good. Now I'm going to go back to the upper and then we'll be done. We're on the home stretch here. Hi.
Hi.
Okay, I'm going to turn you this way a bit. Good.
A lot better than just a regular tattoo. My friend neighbor has a regular tattoo looks awful.
Well, it's so dark.
Dark, yeah, it's dark, yeah.
That's all you look at.
Yeah.
You know, you look at them and it's like,
It's the first thing you see. Yes, yeah, the dark, yeah.
Yeah, you definitely, are you talking about eyebrows?
Yes.
Yeah. For sure, I'm very conservative. I'd rather see you twice and darken than to go too dark because you can't take it off and then they look hideous.
it
They
looks
just look,
awful.
they look too,
Looks like a magic marker.
yeah. Yeah, it's really sad. And that's, unfortunately, I see that at least once a week. Someone will come in and say, I had them done, you know, at the nail place across the street, or, you know,
That's where
this.
she had it done.
Oh.
The nail place across the street.
Yeah, I hear that a lot.
And I felt bad because I said, oh, I want to get that done. And then after she got it done, I said, oh, I'm thinking about it.
Well, it's because they only pay, you pay $100 and they don't know what they're doing.
Yeah.
They don't, they don't care. You
So
know,
when
it's
you do the eyebrows, do you kind of put it on to see if the shape works for
yes,
you?
yep. I have you come in. We do a consultation.
Okay.
And that way we can discuss, you know, the color, the shape. I go over everything with you. But the key with any permanent makeup is to go to someone who does it a lot and is certified, because there's no regulations in Arizona. So anyone can tattoo your face and could just buy this stuff and start tattooing.
Yeah.
And then you want to make sure that you're conservative with the color and how much you put on, because it can't be removed, and you'd rather come in and touch it up and add than to go too much, as you saw with your neighbor.
So the microblading, can you only do so many strokes, or does it have to be the full?
I actually don't do, it's not called microblading. That's kind of the newest buzz, and I do have a sheet out there because everyone's like, oh, microblading this and that. What microblading is a blade, and they slice the skin, make cuts, and then they take a Q-tip and dip it in the pigment and smear it on the cuts, and then the pigment sits in there. That's all microblading is. But with microblading, it can cause scarring. It's very traumatic to the tissue. Usually people that are older, it's not good for. You're going to be redoing it probably every 12 to 18 months. So it's a completely different than what I do. I do a tattoo with a hair stroke pattern. So I'm using the needle in my machine, and I make the strokes, and I'm putting the color in as I'm doing it. I'm not slicing and then putting in the color. So there's a difference.
Can you put a few strokes though, instead of the whole brow?
Yeah, so right on the wall out here, I have pictures of the hair stroke.
Oh, okay.
So take a look, because that'll show you what a hair stroke looks like. Now open both eyes, good, and look right up at me. Beautiful. Yep, I'm almost done. We'll come right up. Yep. Beautiful. You did it. Yay. So I'm going to just irrigate your eyes one more time, and then I'll sit you up.
And I did it because I have full confidence in you.
Oh, you did awesome. So your eyelids will feel a little beat up. That'll calm down in about an hour, okay? So I just use an eye wash to irrigate the eyes. Look up at me one more time. Good. And that keeps you from having to wipe too much, which can be really irritating to the skin. Just cleaning here.
And you do eyebrows too?
Yes, lots of eyebrows. I've done Joanne's eyebrows. I did her sister, Joyce, who's lingering around here. Open and look at me again. Both of the ladies had their brows done before, years ago somewhere, and then I redid them for them.
And you've been doing this for 17 years, haven't you?
Yep, I've been here for almost 18 years, and I do a lot of makeup. You did good. Did you get a good shot at the end? Okay. All right. So what I'm going to do is sit you up, and then we'll go out and introduce you to the world.
Oh, my.
Oh, because that looks good.
We have her sit up. Let's get a good shot for the video real quick, and then
sit
we'll
up.
introduce her.
Let me take this out just so you don't slide when I sit you up here.
Yay.
Yay, so you can see her before with up there with no makeup. Did you get a shot?
Let me show the more.
So pretty.
And
I do love it. Thank you, Stephanie.
Look directly at the camera. There we go.
You did it. Yay. Hope it wasn't too